All right, this is my cultural contact presentation by Kirk Woodruff. So the first thing that I did was, which was really, really fun for me. So I had about, how many years has it been now? Almost 6 years ago, I lived in Mexico for a couple years, and during that time, I came to get to know a family down in Oaxaca, Mexico, really well. It's the Ramirez family. Anyways, a little while ago, I got to FaceTime with them. We FaceTime for about an hour, and I got to talk to them and just kind of catch up with them, how things are going and what they're doing in their lives, which was a lot of fun. But, we were only speaking Spanish. They only speak Spanish. So anyways, some of the things that I thought was pretty interesting that I, had forgotten about since I've I've lived there, was the speed of their speech. So it took me a little bit, probably about like 15 or 20 minutes to really catch on kind of again, because they, speak so quickly. And so it took me a little while to kind of catch back up to speed so I could really understand what they were saying. I had to ask them multiple times to, what did you say? So it was just something interesting I forgot about. Another thing was, which a lot of people use, especially down in Oaxaca, as a slang term, ba. They say ba, like and what it means is, okay, sounds good, or deal, or hey, do you want to go to the grocery store? And they go ba. They go, okay, let's go. And then also something else that I'd kind of forgot about was the accent. So a lot of people kind of leave off the last part of the ending of words, and it's just kind of I think a cultural thing. So instead of, for example, saying the word pues, which is kind of a filler word in Spanish, is like well, or they'll say pue, or instead of saying vámonos for let's go, they say vamos. Like they don't finish all the words. And so it was just kind of something interesting. It was a lot of fun to catch up with them again. So for the next hour, again, I work at the Dora Clinic at the ASDO Clinic, or the Arizona School of Dental Oral Health here in Mesa, and I'm the patient coordinator. And so I do spend a lot of time just on the phone talking to Spanish patients. And some of the things that I kind of wanted to go over that, on the phone that I use a lot was when I call a patient to confirm an appointment. When somebody answers, I introduce myself, and then the next thing I say is, se encuentra Maria, or whoever it is. And, it's kind of reflexive. Some of the stuff that we've been going over is, is so-and-so found, or is, we would say, is someone there? Is Joe there? So, and then when I'm actually talking to the patient, and, I ask them, I tell them, hey, I'm calling to confirm your appointment for this Wednesday. And le marqué para confirmar su cita el día de miércoles a las 2 de la tarde. So I do a lot of, that. And then as a farewell, or, greeting, farewell, one of the things, we say is, have a good day. And that's, que tenga buen día. It's like, have a good day. So I did an hour of, patient coordination. The next 2 hours for my culture contact, I spent actually in person with patients in our actual clinic, because I also assist the doctors and the fourth-year dental students at the clinic. And so, my responsibility, especially when we have Spanish patients in there, especially if I'm the only one that speaks Spanish, I'll go out to the waiting room and, ask, I'm looking for Joe Martinez, obviously in Spanish. And then, so I'll take them back to their room. And while we're walking, I'll ask them how their day is going, and, kind of get to know them a little bit better. And then once we actually get into the operatory room, I show them you can sit here, se puede sentarse aquí y esperar hasta llega el dentista. So, sit here and just wait until the dentist comes in. And then once the student or the doctor comes in, I do a lot of translating. So asking them, where do you have any pain? ¿Tiene algún tipo de dolor de los dientes? And if they do, which side is on, cuál lado of their mouth it's on. So I do a lot of translating. And then, as we're going through, taking the patient through the procedure we're about to do, whether it's just a filling or we're doing an extraction, at the end of, after explaining exactly what we're going to do, always, ask them, hey, do you have any questions? Do you have any concerns? ¿Tiene alguna pregunta o preocupación de este the procedure? So that's a lot of fun. I get to spend a lot of FaceTime with patients speaking Spanish, and that's always fun to do. So in conclusion, I spent an hour FaceTiming with the Ramirez family, which is a lot of fun for me. And then I spent another hour doing patient coordination, talk to people on the phone and making sure they know where our clinic is and their appointment time. And then another 2 hours actually assisting and talking with patients and getting them comfortable with the procedures that are going to go on. So that's it for my cultural contact presentation. Thanks.